As you move into your Act 3, when work and child rearing are behind you, taking care of your teeth should move up on your to-do list. Dentist Steve Marsh is here to tell us why mouth maintenance is increasingly important as we age. So welcome back to the show.
Yeah.
Sounds like you're maybe talking about a New Year's resolution
Well,
here.
what better time? You know, we talk about losing weight and getting healthy again and maybe going on a treadmill. But it's also really important we take care of our teeth as we get older, as we age, mature, not just from a smile perspective, which is what we often talk about, but think of it, all of our nutrition comes in through our teeth. And I can't tell you how many people have come to me with teeth problems, and they say one of the biggest problems is they don't feel like they're chewing their food well, which also means that they're having some stomach issues as well. So it's all about keeping your teeth. This is a woman, and Lori, the before and after. The reason we showed this, or I thought it was important, the woman on the left looks like she has a pretty nice set of teeth. In reality, she had periodontal disease, which some people used to call pyorrhea. When we took x-rays, there was literally no bone. Those teeth were loose. There was swelling in the tissue. The after picture looks great, but all of those teeth had to be removed. The upper with a full denture, the lower with a denture, and then some implants to hold it.
Wow. So that chewing is so important. And you recently made a house call that really, brought the point home. So tell us about that.
So a patient of mine is in an assisted care facility. She also had been to the hospital. She had had some, as luck would have it, some intestinal problems. And I looked at her, and she had been there for 2 or 3 days, and I said, have you brushed your teeth? Has anybody done it? And we had actually restored those teeth to health and said, you know what? I can't get out of bed. I haven't even had my teeth brushed. So one of the things I'll tell our patients or viewers is that oftentimes it's important to brush people's teeth, whether in a hospital setting or in assisted care. In my right hand, the viewer's left, you see a spin brush. You can buy them for $5 or $6 at any pharmacy. The other is Prevident. Prevident is a very strong toothpaste. It's given by your dentist. It's prescribed. It has a high degree of fluoride. So at least we'd like it after every meal in a hospital or assisted care setting, but at least once a day at the end of the day, a caregiver or a family member should help clean their teeth.
Okay, so what if the teeth already aren't functioning well? So what if we've lost teeth? Is there something that can be done?
Well, fortunately, there's a lot of different things we can do in dentistry today, and we thought the best way, again, is to show people photos of it. And these are patients that I've treated. A gentleman who had come to me, and he said he had lost his partial. Remember, in the old days, people had these partials with metal hooks and that sort of thing. And we talked about replacing those teeth, and because of economics and a few other things, we were able to do it just with what's called a Flexite partial. That does go in and out. He said it feels like his own teeth. It's very comfortable. It's very light. As you notice, Lori, there's no metal. So again, he was missing the 4 and the 5 in the front. He was missing a couple in the back. So this is a patient who came to me, also had been in an assisted care facility. It wasn't the facility's problem. It was actually hers. Again, not much attention to teeth. The upper teeth we restored after taking most of them out. We used a combination of some crowns and a partial, and in the lower we redid those, and we actually did veneers. Though she was in an assisted care, she wasn't that, she was in her 60s, and so she said she feels great, and her sister said she smiles like she never has before, so it makes us very proud. In her lower arch, I mentioned doing some veneers and crowns. That's that same patient before and after. She functions well. She said she chews better and certainly looks better as well.
All right. Those are great pictures.
Well, I just want to impress upon our viewers that teeth aren't always about smile. It's about chewing. It's about function. It's about feeling comfortable when you visit people.
Right.
All that is very important as we move on to this new year.
All right. Excellent information. In your Act 3, it's time to take a second look at how you're treating your teeth. Follow Steve's advice and resolve now to maintain their health and function so you can enjoy this time of your life to its fullest. Need help? Give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.